Welcome to this episode of Morning Report Emergency Medicine. I'm Alec Weir. This is the case of a real cutie. A 19-year-old female with a history of hemoglobin SS, or sickle cell disease, requiring chronic transfusion, presents with chest pain. Started this morning, it's sharp and worse with inspiration. It's associated with shortness of breath and a productive cough for 1 week, but she's got some sick contacts at home. Here are her vitals. Temperature is 38.6, her heart rate's 128, blood pressure of 115/75, breathing 28 times a minute, setting only 89% on room air when she hits the door of your emergency department. Nothing on this screen right now is good. So she gets resuscitated, right? She gets oxygen therapy, she gets antipyretic, she gets IV fluids, but what's going on here? Here is her chest x-ray, and look at this. It's so dramatic, it's so obvious, it's hitting you right in the face. Look at that scoliosis. Nah, I'm just kidding. Look at the infiltrate we have here in the upper segment of the left lower lobe. And how do I know it's in the upper portion of the lower lobe and not in the lower portion of the upper lobe on the left? Well, you look at the lateral and you can see right here, this is the upper portion of the lower lobe. If it had been up here, this is the lower portion of the upper lobe, but very clearly infiltrate on the left side. The formal read, confluent opacity in the superior segment of the left lower lobe, minimal infiltrate in the right lower lobe concerning for pneumonia, and then scoliosis. And here's her CBC. White count of 24,000. And then what else? Her hemoglobin of 5.5. We know she needs chronic transfusions. That's in her history, but 5.5 is too low. This is acute chest syndrome. And here's our definition for acute chest syndrome. A new infiltrate on chest x-ray plus any one of the following. Temperature greater than 38.5? Yep. Cough? Yep. Wheezing? She didn't actually have any of that. Tachypnea? Yep. Chest pain? Yep. We have acute chest syndrome. This is a life-threatening lung infarction. It's the leading cause of death in adults with hemoglobin SS, although it's most commonly seen in 2 to 4-year-olds. The treatment for acute chest syndrome, well, you attack every part of the disease. They need oxygen therapy. These patients will be hypoxic. They need IV fluids. And these patients need aggressive analgesia. Usually they'll get antibiotics. These people get packed red blood cells shooting for a hematocrit of 30. And then the sickest of the sick, they get exchange transfusions. This is like plasma exchange, but they're exchanging your red blood cells and not just the plasma components. Our patient got resuscitated in the emergency department, admitted to the ICU, underwent exchange transfusion, and was discharged on hospital day 10. Our take-home points: new infiltrate plus. That's acute chest syndrome. New infiltrate plus temperature greater than 38.5, cough, wheezing, tachypnea, or chest pain. How do you resuscitate them? With IV fluids, antibiotics, aggressive analgesia, blood products if they need it to a hematocrit of 30, and then the sickest of the sick, these people should get exchange transfusions in your ICU. Thanks for watching. As always, you can follow me on Twitter at Weir_Alec or subscribe to this channel for more updates from Morning Report Emergency Medicine. Keep your eyes out for those interesting cases.